A dedicated athlete reaches the peak of his cardiovascular workout, appearing in perfect physical condition, right until his heart violently seizes in his chest. On paper, this individual did everything right. He aggressively cut dietary fats, maintained a strict exercise regimen, and brought his LDL cholesterol numbers down to a range most doctors would applaud. Yet, without warning, a massive myocardial infarction struck. He followed every standard guideline of modern medicine, tracking his blood panels with absolute precision, and suffered a fatal cardiac event anyway. The harsh clinical reality is that perfectly managed cholesterol numbers do not render you immune to sudden cardiac death. Millions of people are passing their physicals while carrying an invisible, unmonitored risk. We assume heart disease follows a plumbing model. We picture our arteries as mechanical pipes, slowly filling with a thick yellow sludge of fat until completely choked off. But clinical data proves this slow clogging pipe model is a dangerous medical myth. By treating the cardiovascular system like household plumbing, patients live in a state of false security, tracking the wrong biological metrics, while the actual mechanism of disease remains entirely out of sight. Escaping the hydraulic heart trap requires discarding the plumbing analogy entirely. To understand what actually stops the heart, we have to look closely at a completely different biomechanical process. Data reveals a staggering fact. Over 70% of heart attacks originate in arteries less than 30% blocked. Soft vulnerable plaque manifests as a microscopic, highly inflamed pocket buried deep underneath what looks like a perfectly clear arterial wall. Because this fragile plaque cap cannot withstand a sudden surge in systemic blood pressure, it violently tears open, exposing its toxic interior to the bloodstream. Your body detects the rupture and attempts to heal the catastrophic tear the only way it knows how, by instantly flooding the site with platelets to form a massive blood clot. It is this sudden, massive clot, formed in a matter of seconds, that completely seals the artery and suffocates the heart muscle. The total volume of fat resting in the vessel prior to the tear is largely irrelevant. A fatal heart attack is a sudden, violent structural failure of the arterial wall. It strikes fast, leaving no time for intervention. If the event is driven by pressure ripping a fragile membrane, we have to ask exactly what degrades the arterial wall, making it brittle enough to tear in the first place. The answer begins with vitamin K2, specifically the MK7 variant. In a healthy system, K2 functions as a biological GPS, actively guiding circulating calcium into the skeletal structure where it belongs. When you are deficient in K2, calcium is left unguided. Instead of fortifying your bones, it drifts through the bloodstream and embeds directly into the vascular tissue. Over time, the normally smooth, highly elastic artery eventually turns into a rigid, solidified stone pipe. Healthy arteries flex and expand to absorb the immense pressure of every heartbeat. When elasticity is destroyed by calcification, the unyielding wall forces the soft plaque underneath to absorb the full mechanical shock. Without natural flexibility, the rigid wall easily cracks the hidden plaque. But why does the soft vulnerable plaque exist in the first place? To trace this biological cascade to its absolute root, we must look at the exact mechanism creating the initial injury. The injury does not originate from naturally occurring saturated fats, but from modern dietary toxins, specifically high fructose syrups and highly processed oxidized seed oils. High fructose syrups dries a process called glycation that binds to proteins in the blood vessel wall, while oxidized seed oils release unstable free radicals. These volatile chemical insults act as microscopic sandpaper against your vessels, severely scouring the delicate inner lining and creating jagged, dangerous microtears. Your immune system attempts to patch these continuous microtears by sending in cholesterol to repair the damage. The vulnerable soft plaques are simply the biological scabs your body builds as a desperate defense mechanism against relentless internal scratching. Standard industrial fats are the true patient zero of cardiovascular disease. They inflict the exact vascular trauma that initiates the entire deadly cascade of inflammation and eventual rupture. To survive the hydraulic heart trap, patients must stop relying solely on a basic total cholesterol panel to determine their cardiovascular risk. Looking at this standard lab report layout, you need to instruct your physician to request these exact markers: an hs-CRP test and an ApoB panel. High-sensitivity C-reactive protein measures the precise level of systemic, structural inflammation occurring inside the vessel walls. It is the leading indicator predicting when an unstable plaque is nearing the threshold of rupture. ApoB, meanwhile, accurately measures the specific concentration of particles that actively drive inflammatory damage directly into the arterial lining. Adopting these precise tests moves a patient away from broad statistical guesswork and establishes a highly specific structural risk assessment. The first active intervention is to deploy vitamin K2 as MK7 into your daily protocol. This biological cofactor physically pulls rogue calcium crystals out of the vascular walls and safely locks them back into your skeletal structure, restoring critical arterial flexibility. The second step is to immediately eliminate high fructose syrups and oxidized seed oils from your diet, halting the continuous micro-scratching that forces the body to build dangerous plaques to begin with. Preventing a cardiac event requires a shift in focus toward managing sudden structural stability, moving past the common obsession with slow fat accumulation. Tracking specific inflammatory metrics and aggressively protecting your vascular architecture is the only proven method to stop a plaque rupture and escape the hydraulic heart trap.